Sexual Education for Children, a comprehensive guide for parents. Hello and welcome. Today we're diving into one of the most important, yet often misunderstood aspects of parenting: sexual education for children. This topic is not just about teaching children about reproduction, it's about helping them understand their bodies, respect boundaries, and develop healthy relationships. Sexual education starts from birth and evolves as children grow. It's a journey that requires patience, understanding, and open communication. In this video, we'll explore why sexual education matters, the potential risks of neglecting it, and how parents can approach this topic with care and confidence. Why sexual education starts at birth. Sexual education is not a one-time conversation. It's a continuous process that begins in infancy. From the moment a child is born, they start learning about their environment, including how they interact with others and how others interact with them. For example, when parents use the correct names for body parts, they're laying the foundation for healthy communication. This simple act helps children feel comfortable discussing their bodies and asking questions as they grow. Teaching children about personal boundaries is another crucial aspect. By helping them understand that their body belongs to them, parents empower children to recognize and assert their rights. The risks of neglecting sexual education. Neglecting sexual education can lead to several risks, including lack of awareness. Children who are not taught about their bodies may struggle to recognize inappropriate behavior or abuse. For instance, a child who doesn't understand the concept of private parts may not report uncomfortable situations. Low self-esteem. Without guidance, children may develop feelings of shame or confusion about their bodies, affecting their confidence and self-worth. Vulnerability to exploitation. Children who lack knowledge about boundaries are more likely to be targeted by individuals with harmful intentions. Difficulty in relationships. As they grow, children who haven't learned about respect and consent may face challenges in forming healthy relationships. These risks highlight the importance of starting sexual education early and continuing it throughout childhood. How parents can approach sexual education. Parents play a vital role in guiding their children through this journey. Here are some strategies to ensure sexual education is effective and age-appropriate. Use correct terminology. Teach children the proper names for body parts to promote clear and respectful communication. Respect personal boundaries. Encourage children to say no if they feel uncomfortable and support their decisions. Create a safe space for questions. Let children know they can ask anything without fear of judgment or punishment. Introduce age-appropriate topics. Tailor conversations to your child's developmental stage. For example, toddlers can learn about privacy, while older children can discuss consent and respect in relationships. Model respectful behavior. Show children how to treat others with kindness and respect, reinforcing the values you want them to adopt. The long-term benefits of sexual education. When done correctly, sexual education has profound benefits for children, including increased confidence. Children who understand their bodies and boundaries feel more secure and self-assured. Better communication skills. Open discussions about sensitive topics help children develop the ability to express themselves clearly and respectfully. Healthy relationships. Learning about respect and consent lays the foundation for positive interactions with others. Reduced risk of abuse. Knowledge about boundaries and rights empowers children to recognize and report inappropriate behavior. Addressing sensitive topics with care. Sexual education involves discussing sensitive topics, but it's essential to approach these conversations with care and professionalism. Parents should focus on creating a supportive environment where children feel safe and valued. For example, if a child asks a question about reproduction, parents can provide a simple, age-appropriate answer without overwhelming them with information. The goal is to educate, not intimidate. Preventing misunderstandings and promoting positivity. To ensure sexual education is effective and well-received, parents should avoid using euphemisms. Clear and direct language prevents confusion and promotes understanding. Focus on empowerment. Emphasize the importance of self-respect and personal rights. Encourage open dialogue. Regular conversations help children feel comfortable discussing sensitive topics. Conclusion. Sexual education is a journey that starts at birth and continues throughout childhood and adolescence. It's about teaching children to respect themselves and others, understand their bodies, and navigate relationships with confidence and care. As parents, you have the power to shape this journey, creating a foundation of trust, respect, and open communication. Remember, every conversation you have with your child is an opportunity to guide them toward a brighter, healthier future. Thank you for joining me in today's discussion. Together, we can ensure that every child grows up feeling safe, respected, and empowered.